a couple seconds. Okay, we are good to go.
Measles information. Measles is an infectious disease, typically in children, that cause a fever and a red rash to appear on the skin. Symptoms can start to appear usually around 7 to 14 days after being infected. Other symptoms include runny nose, cough, watery eyes, and white spots in the mouth. It can become very serious and cause pneumonia and even lead to death. This disease is transmitted through a virus that spreads through the air and received through an inhalation. It spreads very easily, and while uncommon here in the United States, is very prevalent in other countries. The best way to prevent measles is to be informed. Our intervention to help the people of the Democratic Republic of the Congo is to host a measles clinic. The purpose of this clinic is to inform the people on what measles are, how to prevent them, how to treat them, and any other useful information they would need. We would also provide vaccines for those who would want it and let them know where vaccines are available once the clinic ends. Each measles clinic will be conducted on every Saturday for 1 month. This allows the people of the Democratic Republic of the Congo to find time to attend a clinic. Occur twice a year, during the month of December and during the month of May. This is when measles season begins and ends, and be aimed for children, but all are welcome.
Okay, so a little bit about the education on measles. Any type of awareness of measles, it seems as though there isn't much awareness only to people in the community who educate others on vaccinations. Since this measles has been more of an outbreak and more children are getting it, the awareness part of the disease is put on the back burner, and treating measles is the main priority. One community worker named, I'm just going to guess her name, Elistoni Mapanga Wambaza, works for ALIMAS, which is the Alliance for Medical Action, and she's been raising awareness by shouting with a megaphone in the streets of Kimboganga. I'm not very good at that. Okay, and then 400 people have been killed actually in the southeast in the Republic of Congo, and 32,000 have been infected since 2015. UNICEF and ALIMA have been working with the UN and government to help with the outbreak. Vaccination is free along with medical care, and the ALIMA actually helps mothers, like we were talking about, take their children into UNICEF medical site, where they are shared awareness as well as treatment for measles and prevention for measles. A little bit more on continuing about the education of measles. ALIMA has not only helped raise awareness of the vaccinations in Congo, but they also traveled to new places like New Guinea and other places in the sub-Saharan countries in Africa. Wambaza states that people reject the awareness of vaccinations and measles because of the cultural beliefs and traditional healthcare practices that are much more of a holistic approach. Wambaza goes on to say that there's been reduced awareness in the expanded program of immunization, and it's not organized. That results in low vaccinations and coverage, as well as poor handling of the cold chain. This leads to poor management of outbreaks and alerts. YAPI and the WHO organization professionals are also raising awareness in the Congo. Measles is, like we said, it's a virus that originates in the nose and the throat. It is airborne, so sneezing will trigger it as well as coughing. It actually lingers up in the air for 2 hours, more than the common cold. It can cause a rash and fever. The CDC also says that, the MR shot is a great way to prevent getting measles, mumps, and rubella. So yeah, just making sure we're out of contact with that. And then plans for educating after learning about this ALIMA in the Congo. We plan to establish a clinic, usually to help out children because it's more infectious to children. We want to be able to educate mothers on how to prevent measles for their children and as well for themselves, making sure to keep clean, cover their mouth, and avoid contact, especially with those who have measles, which they should be quarantined already. volunteers would actually have a small tent, and they would use a megaphone to communicate to the public, as well as some signs regarding to what the volunteers are doing. Treatment plans would be on set for those who have the first stage of measles and are on the ongoing stages of measles. The MMR shots will be spread as awareness as well the side effects of measles and continuous application of the shots for the mothers. And then we want to be able to talk to the mothers about isolation, because sometimes it takes a while for their children to be isolated.
So for our intervention, we saw that it is best that we treat children and adults who have not received the vaccine and provide it to them. If we get the vaccine from CDC, it costs $21 for a pack of 10, so that'd be something that we would just offer to people since they couldn't afford that. And they will be given a first dose. They have to be at least 12 months old. And then the second dose, they're usually between the ages of 4 and 6, but it can also be given 20 days after the initial dose, depending on what works best for the people there. And it has been seen that 2 doses of MMR vaccine are 97% effective against measles and 88% effective against mumps. But only 1 dose of MMR vaccine is 93% effective against measles and 78% effective against mumps and 97% effective against rubella. We would like to train the employees of local hospitals in providing these clinics with us so that they can become self-sufficient and be able to treat the children continuously as we leave, so we can just provide vaccines to them and then they can do the rest of the work locally.
And as part of our intervention, we want to educate everybody on how they can treat measles in case they do come down with the infection. There is not a prescription or medication that can cure measles, and as such, it's the leading cause of death in children, and symptoms generally last for 2 to 3 weeks. However, there are many different treatments that can help save the lives of those infected, and educating those at risk of the disease is very important. So medications that can be taken for the measles should be to help prevent or help to control fevers, because the fevers are very dangerous when uncontrolled. Many times fever reducers are needed. Good options are acetaminophen, ibuprofen, and naproxen. Never use aspirin in children or teenagers with a fever, as it can lead to Ray's syndrome, which can cause a whole lot of other problems. Antibiotics might be needed. Antibiotics can't help cure measles, but it can help with other infections that can occur when someone is suffering with measles, such as pneumonia or ear infections and such. Children with vitamin A deficiencies are likely to have a more severe case of measles, and so giving vitamin A supplements can help lessen the severity of the disease. Some home remedies: always stay in contact with a doctor if possible. You want to take it easy, sleep as much as you can, try to relax if possible. Stay hydrated, drinking lots of fluids, mainly water, especially while experiencing a fever. The more you sweat and things with a fever, the more you should be drinking. Seek respiratory relief. If it's possible to get a humidifier, try using a humidifier, as it can help relieve coughs and sore throats. And one important thing, the measles infection can cause a lot of eye sensitivity, so always want to protect your eyes. So stay away from bright lights, wear sunglasses or hats. Try and keep the sun out of your eyes and bright lights away.
So we believe that providing these vaccines to these people will help solve the issue of measles in the Congo, because the vaccine is 97% effective. So it would help in preventing the illness of measles. And then we also think it'd be helpful in providing the education on the matter about the importance of vaccines and how to treat measles once acquired. And providing this education can help the people know why they need it and why it's important to get the vaccine, and help the mothers understand this is a part of what they need to do to protect their children. And lastly, we'd like to train local hospitals in providing these clinics so that they can become self-sufficient. And then all we'd have to do is send them vaccines so that they can treat them themselves.
And yeah, awesome.